Hospital workers. What regrets do you hear from dying patients? She was one of the long-stay patients I got to know really well. Late 60s, no kids, no spouse. She lived alone most of her adult life, and she was fine with that. She had a little house, garden, a handful of good friends, and a dog, Murphy, a big old golden retriever that was getting up there in age. She used to tell me about the walks they'd take and how Murphy would lay across her legs like he still weighed 30 pounds, not 90. She came into the hospital for complications that turned out to be more than that. A few scans later, and the doctor came into the room with the results. I was in there helping her sort her bedding, and I stayed. It wasn't intentional, but she didn't ask me to leave. The doctor sat down, told her the cancer had spread too far. No treatment would change the outcome. A few weeks left, maybe a month. She nodded, didn't ask many questions. When he left, she looked out the window for a long time. I didn't say anything. I just stayed with her while she stared. Over the next few days, she was calm, almost peaceful. We talked about her house, her friends, her dog. She told me she'd lived a beautiful life. Not glamorous, not rich, but happy. She said that a lot. I was happy. I remember thinking how rare that was, to hear someone at the end of their life say that and actually mean it. 10 days after getting the news, I was helping her into the tub. She liked to soak in warm water to ease the pain in her back, and I always tried to make sure she got a bit of dignity in those moments. I was steadying her as she stepped in, and she just stopped, froze really, and started crying. Not sniffling or tearing up, a deep, shaking cry. She held the edge of the tub like she was going to collapse. She said, "I shouldn't have done it. I shouldn't have put him down." At first, I didn't understand what she meant. Then it clicked. She was talking about Murphy. She told me she'd put him down the day before she came to the hospital. She knew she was dying, so she thought she was sparing him the confusion, the stress of being alone after she was gone. But now she regretted it. She kept repeating it. "I should have waited. I should have brought him with me. He would have laid by the bed. We could have gone together." I held her up and got her back to the bed. She was shaking, barely able to breathe between sobs. She wasn't crying because she was afraid of dying. She was grieving that she'd made that decision too soon, and it haunted her. She felt like she'd betrayed the one being who never left her side. It was the first time I saw her cry about anything. She died 2 days later in the early morning, around 4:30 a.m. I was on shift that night. She didn't seem in pain. Her face was relaxed. But I kept thinking about Murphy and the way she cried. I took 2 days off after that. Didn't really tell anyone why, but I needed the time. I spent one of those days scrolling through pages of dogs for adoption. I haven't adopted one yet, but I think I will. I also started looking at job postings outside the hospital. I don't know if I'm done with this line of work, but something about the way she looked when she broke down stuck with me. That was the first time I'd seen someone's biggest regret be about a dog. And honestly, it hit harder than most things I'd heard.